Nurse Patty. I'm Brian Hinckley.
Okay, can you give me your date of birth?
Sure, it's September 6th, 1975.
Okay, all right. Today we're going to be doing a head-to-toe assessment, and for purposes of education, we would like to videotape, and I need your permission for that.
Absolutely.
Okay, all right. First, do you have any allergies?
Not at all.
Okay. And I see your vitals were all within normal limits. Your temp was 98.2, heart rate 66, respiration's 18, blood pressure was 120/80, and you were 100% room air. Correct?
Yep.
Okay. All right. Do you have any questions or concerns about anything that we may be going over today? Your heart, your lungs, anything like that?
Mm-hmm.
Okay. I see you had prostate surgery in May. Do you have any complications from that?
Not at all. It's been great.
Good. Okay. All right. So, can you tell me what the date is?
Today's date?
Mm-hmm.
Yeah, October 19th, 2020.
Okay. And where are you at right now?
The hospital.
Okay. And give me a current event.
A current event? There's about to be a big election between Trump and Biden.
Okay. All right. All right. Being that it's a head to toe, the first thing I'm going to do is check your head. So I need you to tilt your head forward for me. All right. And I look for any abnormalities, lumps, bumps, stents. All right. And I don't feel any. Okay. Head up. And then I'm going to take temporal arteries. Okay. And then your tempomandibular joint right here. So I need you to open your mouth. Okay, close. Do it again. Okay, good. All right. Now I'm going to check your cranial nerves. All right. And I'm going to start with the second cranial nerve, which is your optic nerve. All right. I'm going to, first of all, 15-degree angle. And I'm going to find the red. There it is. Okay. And on this side.
Mm-hmm.
Again. Okay. Now I'm going to check your pupils. So.
As long as you don't dilate them like the eye doctor.
No, I won't do that. Okay. All right. I'm going to check direct first. Okay. Now I'm going to check consensual. Now I want you to tell me when you see my hands.
No.
Oh, good. Good. All right. All right. I'm back with that. Okay. Now I'm going to do your nodes, your lymph nodes from up here. All right. You have pre-auricular, which is right here. Okay. Post-auricular. Tonsillar, submandibular, submental, occipital. Okay. And I see that your trachea is midline. In your cervical nodes. Anterior. Posterior. And can you turn my head, or turn your head so that I can do your deep cervical chain? Going to do the third, fourth, and fifth cranial nerve, which are your oculomotor, your trochlear, and your abducens. And what those have to do with is your field of gaze. So I'm gonna put this up and I want you to follow this. Do not move your head, just your eyes. That's called the cardinal fields of gaze, all right? Perfect. Now follow. Okay. All right, and then your fifth cranial nerve that we passed by is your trigeminal, which has to do with your motor and sensory, all right? So again, I'm gonna have you open your jaw once, okay, close. Now make your jaw go side to side. Okay. Now I have hard and soft. And I want you to close your eyes and I want you to tell me which one you feel.
Soft. Hard. Soft. Soft. Hard.
Okay, good job. Okay, then we have your, the seventh cranial nerve is your facial nerve. So I need you to drop your thing for just a minute.
Mm-hmm.
I need you to, first of all, lift both eyebrows at the same time.
Okay.
All right, now I need you to smile, frown, and puff out like a fish. Good job, okay. Then your next cranial nerve that we're gonna discuss is your 9 and 10, which is your glossopharyngeal and your vagus. Those have to do with your swallowing. So I need you to show me your throat so I can watch you swallow, and then I'm gonna look in your throat. Okay, swallow. Okay, now can you open your mouth, stick out your tongue, and tell me ah. Okay, your uvula is midline, and your soft and hard palates are moving, and I don't see any other abnormalities in there, so that's good. All right, your next one is, we'll do 10 first. 10 is your hypoglossal, so I need you to stick your tongue out at me. Okay, now move it side to side. Perfect, okay. And we're gonna go back to 11 now, which is your spinal accessory. And I'm gonna push down resistance, and I want you to shrug your shoulders up. Okay, perfect. All right, all looks good.
All right.
All right,
I'll help.
so the next thing we're going to do is we're going to assess your anterior thorax, which is this area. Okay, so first I inspect, and I don't see, it's symmetrical. I don't see any pulsations, no dents, no bulges. Everything looks good. Okay, so then I'm going to palpate. So I'm just going to feel for any abnormalities. Okay, all right, now I want you to say blue moon for me.
Blue moon.
And again.
Blue moon. Blue moon. Blue moon.
Good job. Okay. Now, I'm going to listen to your heart sounds first and then your lung sounds, okay? So first I'm going to do your carotid artery. All right, I'm going to do first with my diaphragm. Then with my bell. Now I'm going to listen to your valves, okay? And the first one I'm going to find, I'm going to go down to your second intercostal space. And I'm going to find, this is your aortic valve. Okay, I'm going to go straight across to your left side, and I'm going to listen to the pulmonic valve. All right, then the next three intercostal spaces are the Erb's point, and right underneath that, we're going to find your tricuspid valve. And we're going to go to the mid-clavicular area, and we're going to find your mitral valve. All right, now I'm going to listen with the bell. Same thing, mitral, tricuspid, Erb's point, pulmonary, and aortic. Okay, can you lean forward for me a little bit? I'm going to listen to the apex of your heart. A little bit more. It's the strongest part. S1, S2 are present with no additional sounds. Okay? All right, now I'm going to listen to your lungs. All right. Can you take a deep breath in for me? And out. I'm going to try and not let you hyperventilate. Again. Okay. One more so I can get to the sixth intercostal space. Okay. Alrighty, good job. Now I'm going to listen for your bronchial breath sounds, okay, which are up here, right at your trachea. They're much louder and higher pitched than your bronchiovesicular sounds you can hear down here in the second intercostal space on the front. They're a little bit softer. They're not very high pitched. And then your vesicular sounds are the majority of your lung fields. And they're much lower pitched and soft. Okay, now I'm going to have you turn slightly, either way, move it that way. That way I can do your posterior, nope,
Sit up,
I'm
okay.
going to do your lung fields first,
Okay.
okay? First I'm going to do the symmetry, alright, and alright, now take a deep breath. Okay, alright, it moves symmetrically, okay, and again, I'm going to palpate to make sure there's nothing. I don't see anything, but okay. And again, can you say blue moon for me?
Blue moon. Blue moon. Blue moon. Blue moon.
This is the
Blue
bronchoscopy.
moon.
Okay. All right.
Blue
Can
moon.
you? Now I want you to say E E E E E.
E, 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 E.
Okay. It came out as E E E E E, so it's normal. If it had come out A on my end, it would have been abnormal.
Oh.
Okay. Now I want you to whisper blue moon 3 times for me. Okay. I did not hear them, so that's a good sound. Okay. All right. Now again, I'm going to listen to your lung sounds. I'm going to start up here, and again, I need you to take a deep breath for me, and out, and in, and out. And these are your vesicular sounds, so they're softer. Okay. And that's that. Okay, good. Alrighty. Okay, I'm gonna have you lie back and we're going to, check your abdomen now. Feet up. I'm gonna put this up for your legs. Comfortable. Okay. Ooh, alright. Okay, so the first thing I do is inspect, which I see, again, no irregularities. And we do this a little backwards when it's your abdomen. We auscultate first because we don't want to affect your peristalsis, okay? So I'm going to listen to your bowel sounds in all 4 quadrants, starting with your right lower. That was a quick one. Again. You got good bowel sounds. All 4 quads. Okay. Now I'm going to palpate and you tell me if you have any pain anywhere that I push, okay?
Just a little tender there.
This one?
Yeah.
Alright, I'm going to percuss now. And I'm looking for timpani sound versus a dull sound. Okay, alright. Right down here, that was in your left lower quad. Tenderness. Alrighty, so then what we're going to do is let me, since you're already down, I'm going to check your legs. Alright, I don't see any edema. Check your popliteal pulses. And now your dorsal pedis. Good strong pulses. And now your anterior tibial. Good. Alright, I want you to bend this knee for me. Alright, what I'm going to do, I'm going to push, and I want you to resist me pushing down on your leg, okay? Okay, now I'm going to push up, and I want you to resist me pushing up. Okay, and now we're going to do the same thing with this leg.
Okay.
Again, down, up. Okay, now I'm going to do your feet. I'm going to push down, and you try and resist. Alright, now I'm going to push up. Okay, good job. While I've got you in that position, I'm going to test for Babinski reflex. Okay. Ticklish, huh?
Yes, very. Is that normal?
Yes, that's normal. We have the flexion of the big toe, so that's good. Okay. All right, we can have you sit up again.
Okay.
Okay. And then I'm going to check your upper extremities for your range of motion. Okay. All right, hands first. Down, up, down. Elbows. All right. Arms. Okay. Now, I'm going to push against this one again with resistance, and I want you to keep me from pushing it. Okay, and I'm going to pull. Good. Same thing over here. Push, and then I'm going to pull. Okay. All right, let's see hands. All right, I'm going to try and push them apart, and you stop me. All right, now I'm going to try and push that way, and you stop me. Okay, good. Alright. Capillary refill is less than 3 seconds. Fingers are nice and warm. Okay. Alrighty, then I'm gonna do now I'm gonna do this first. I'm gonna do your radial pulses first. Which are equal. I'm gonna do your brachial pulses. Alright, now I'm going to do your deep tendon reflex with your patellar, okay? I'm going to stand to the side just in case you kick me, okay? Good. Alrighty, I'm going to try your brachial radial deep tendon reflex as well, okay? Now this should cause your hand to move. Both sides, make sure they're even. And now your bicep. Oops. Okay, I'm ready. Okay. Alright, now I am going to put something in your hand. I'm going to check for stenosis, and I need you to close your eyes. I'll put something in your hand, and I want you to tell me what it is.
Paperclip.
Good. Okay. Alright, now I want you to take your finger and put it to my finger, and then put it to your nose. Put it to your nose now. Now, finger, put it to my finger, and your nose. Okay, good job. Okay. Alright, now we're going to check for your gait. What size do you wear?
Like a large. Yeah, they'll work.
These ones?
Yeah.
Or the brown ones?
Yeah, they'll work. They're great. They'll work.
Okay, alright. Because I don't want you to walk barefoot
Oh, thank you.
on this floor.
Interesting to see, yeah. Thank you.
You're welcome. Okay, be careful when you step down.
Okay.
Okay, and I need you to walk for me that way and then back again.
Okay.
Just regular walk. Okay, and back again. Now, can you tandem walk? One foot in front of the other like that. This is your driving test one, right? Okay. Good job. Okay, can you walk back on your toes?
Tippy toes, yeah.
Yeah. Now on your heels.
Oh, and here. That's interesting.
Uh-huh. Okay.